a real treat. We know this is a very timely webinar that we planned. We usually do 2 a month, but we squeezed in another one just based on what's going on in the world today. Just a few kind of rules at the beginning. Please make sure that you're muted and also that you've stopped your video. There's a icon in the left lower corner of a microphone and a camera, and if you'll just make sure there's a red line through that, that would be helpful to us. We'll entertain questions at the end of the webinar. Robbie and Cindy will have about 45 minutes of content, and then we'll use the chat feature. You can go in and put your questions in there, and Phyllis Johnson, who serves as our immediate past chair for the consortium board, also helps with the webinars, and she'll help and make sure that they get all your questions and you get your answers. If there's a question that you don't get answered, Robbie and Cindy will have their contact information at the end of their presentation, and you can reach out to them, or you can reach out to me, and I'll make sure that they get your question. We do record all of our webinars, and we post them at healthscienceconsortium.org. You've probably seen that website a couple of times. I know I sent a reminder message out to many of you today, and that link is in there. So probably early next week, this recording will be posted at healthscienceconsortium.org/webinars, and then their PowerPoint will be there as well. So if you want to go back and look at that, you can. If you're interested in a certificate for 1 hour of professional development, keep in mind this is not a CEU. This is just a documentation that you spent 1 hour of professional development with us. And we'll, if you email me, if that is of benefit to you in any way, for recertification credit or for initial certification, if that is helpful to you, we're more than happy to provide you a certificate of participation for 1 hour. Just email me and I'll get that back out to you. And then lastly, I just wanted to remind you that even though our fingers are crossed and we're very, very hopeful that we'll get to have the 2020 National Health Science Conference, we hope you'll consider coming to that. It's a wonderful professional development opportunity. We'll be in Charleston, South Carolina, and the dates are October the 28th through the 30th. And we also will have a pre-conference session on the 27th. Anyone who registers for the pre-conference session will also get to be a part, or will get a complimentary copy of the health science curriculum enhancements. They are being highly revised by 2 very capable teachers, and we are excited about the release of these as they'll be aligned to the National Health Science standards that were updated in May of 2019. So complimentary copy for everybody. That's a $350 value if your state is a member of the National Health Science Consortium, or a $500 value if your state is not a member of the National Health Science Consortium. So a really good prize if you're able to attend the pre-conference session as well. Your presenters today, Cindy LeCoq, lots of experience. She's radiology in her first life, but served as the health science state leader in Colorado, as the chair of the consortium board, and now is our assessment manager. And also Robbie Rauzi, he works with Precision Exams, and they will provide you lots of details and information about health science in the future. So with that, I'll turn it over to our 2 very capable presenters today. Thank you, Cindy. Thank you, Robbie.
Good afternoon and welcome. Before I begin, I would like to take a quick moment to acknowledge and appreciate all the hard work that all of you are doing as we navigate through today's uncertainties, as the impact of the pandemic continues to unfold. You are making a difference in health science education, and thank you. So today's webinar focuses on how the consortium is helping to provide guidance and resources for all secondary health science programs for the remaining school year and for the coming 2020 school year. As we deal with today's crisis, we also plan for the future. Before we begin, just a quick review of terms and acronyms for anyone new to health science programs. Oh, I'm sorry, I skipped over something. Okay. Today's topic is going to be State of the State, Perkins 5 in the CTE Secondary Health Science Programs, the National Health Science Curriculum Framework, the National Science Curriculum Assessment Development, and the 2019 to 2020 National Health Science Assessment, end of program and end of course assessments. And Robbie, could you go to the slide before? I think, there we go. So before I begin on all of that, I wanted to go over a quick review of the terms and acronyms. NCHSE, the National Consortium for Health Science Education that Nancy mentioned, I will either refer to it as NCHSE or the consortium instead of using the whole name. PE is Precision Exams, soon to be Youth Science. NHSS is the National Health Science Standards. NHSA is the National Health Science Assessment. We will be talking about the National Health Science Curriculum Framework, and I want to make sure everybody understands that this is a 4-course template example. Perkins 5 is known as Strengthening Career and Technical Education for the 21st Century Act, and I will just use the shortened version of Perkins 5. As I mentioned, EOP is End of Program Assessment, and EOC is End of Course Assessment. And I will be referring to standards often, and standard definition is that it provides a common language and understanding among different groups. And today's topics, I think I already said this, is that I'm going to be dealing with the State of the State overview of the Perkins 5 impact on all CTE health science programs and how the consortium aligns with the Perkins Directive, specifically the National Health Science Curriculum Framework Initiative and the corresponding National Health Science Curriculum Assessment Development. The webinar will conclude with open discussion of the 2019 to 2020 Health Science Assessment. But before moving forward, I want to set the stage to where CTE has been in the past. This is a quote from the Arne Duncan. He was Secretary of Education from 2009 to 2015. And as we all know, career technical education is very misunderstood as a concept, and this concept has evolved well beyond vocational education, with the residual criticism surrounding the issue of uniformity and consistency among CTE programs. And that's why Arne Duncan made this quote. What is true of one CTE health science program is not necessarily true of another health science program within the nation, the state, even within the school district. And thus, this is the CTE conundrum. Perkins 5 was authorized just last July in 2019. So prior to this, the career and technical education operated under the Perkins 4 defining high quality health science programs I have up on the slide. Out of the 9 criteria that you see, we're just going to focus on the bolded items for what we want to discuss today, on how programs have been evaluated and how the Perkins 5 has taken this criteria and actually expanded upon it. The purpose of the Perkins 5 is to provide individuals with rigorous academic content and relevant technical knowledge and skills needed to prepare for further education and careers. As we all know, a high school diploma is not enough anymore to provide a good living. So when you look at all this criteria, what we're going to talk today is partnerships with business and industry, high quality assessments, coordinating career and technical programs and sequences between secondary and post-secondary educational institutions, and providing accountability. What is profoundly different with Perkins 5 is it shifts much of the definition of what a high quality CTE program looks like onto the individual states to determine their performance measures, with the exception of this first bullet. So that first bullet is Perkins 5 defines CTE concentrator instead of leaving this definition up to the states. And the definition of a CTE, a secondary CTE concentrator, is any CTE student who takes a minimum of 2 courses in a single CTE program or plan of study. And with post-secondary, it would be a requirement of 12 credit hours. And so the other significant changes we see with Perkins 5 versus Perkins 4 is it eliminates the technical skill attainment measure and replaces it with a program quality measure that requires states to choose to report on work-based learning, post-secondary credit attainment, or credential attainment during high school. There's a new formal definition of work-based learning, which emphasizes sustained interactions with industry or community professionals in real workplace setting. It increases the focus on special populations, and it introduces a local needs assessment that requires data-driven decision-making on local spending and involves significant stakeholders consultation and must be updated every 2 years. And these 4 bullets are the most significant changes, and there is such an increased emphasis on work-based learning. Okay, we're going to talk about the secondary core indicators of performance, because this will directly affect our health science programs. And the states have to report on all of these indicators mentioned, but for the purpose of today's webinar, we will only focus on the bolded items of academic proficiency and the measure of CTE program quality. And each state has to pick a minimum of 1, though many states are actually picking 2 or more. And those are the student attainment of recognized post-secondary credentials, or student attainment of post-secondary credits in their CTE program or program of study, or the percentage of students participating in work-based learning. Unlike several other CTE career clusters, health science teachers usually come straight from business and industry and don't have a background in teaching pedagogy. And this is where NCHSE really comes in, and for the purpose of today's webinar on how we help. The consortium was founded over 29 years ago, and its mission of responding to the needs of health science education and the healthcare industry has been steadfast. But exactly what is meant about collaboratively defining and advancing the framework of health science education? It might need more explanation if you're new to health science and new to teaching. And with the need for consistency for health science programs and for the clarification of framework, the consortium developed the National Health Science Curriculum Framework as an example for course program design and assessment development. So the National Health Science Framework is where we're going to focus mostly on this entire webinar. It is based on the National Health Science Standards that provide the framework for all health science programs, both secondary and post-secondary. It is the foundation. The standards are the foundation for everything. The National Health Science Standards cover the essential knowledge and core expectations most workers need to succeed in healthcare careers. The National Health Science Standards allow students clear direction of what they need to know and educators what they need to teach. And it's a framework on which to design curriculum assessments. So Robbie's going to take us to a quick review of the standards that you will find on the NCHSE website. Okay, Robbie, can we see the, yeah, you're good. Okay, there is 11 standards, and the first one being the foundation standard, which is the academic foundation, a very, very large standard. And so much to review, but you can see how detailed it is and how students can look at the standards and know what they need to learn, and teachers on what they need to teach. And so he's just scrolling through this so you can see the detail, and we're still in 1 and now 2, communications. These were newly revised on as of 2019. And again, this is the basic framework for all curriculum development. I hope most everyone is familiar with these standards. Okay. Okay, we can go to the next one. All right, so here we are. Here we're going to start. The curriculum framework divides those 11 National Health Science Standards among a 4-course sample. And these 4 courses provide equal access, high rigor, work-based learning, and potential post-secondary credit. It also, the 4-course example in this curriculum framework supports teacher retention by providing a sample template that can be flexible and provides entry and exit points. And so if you look at, these are the first 2 course descriptions. They are foundational courses, but what you don't see here that I didn't have room on the slide is also the listing of curricular activities and the NCHSE resources that we'll see on the next slide of the other 2 courses. But what I mean by curricular activities is going to be your international HOSA. The resources would be the end of course assessments and service learning opportunities. And if you look at these 2 first courses, you can see how they are your introductory courses. Pretty basic. These next 2 course examples are definitely higher rigor. You will notice they include work-based learning, and these 2 courses will have the potential for concurrent enrollment opportunities. So that's human structure, function, disease, A and B. Please notice the curricular activities that we couldn't see on the other ones because of space. You see HOSA, your work-based learning, internships and apprenticeships. And then if you look at the next course, we see the listing of the resources. The health science curriculum enhancements, these are being revised and will be available of August 2020, so this August. And we also have the wonderful resource of work-based learning. For the first time, you see the end of program National Health Science Assessment, as well as end of course assessments such as medical anatomy and physiology, medical terminology. Also, you'll see specific specialties such as nurse assistant, EMT, etc. The Health Science Curriculum Framework meets the Perkins requirement that all CTE programs should offer multiple courses. Obviously, they have to be a minimum of 2 that start with an introductory course that teaches broad foundational knowledge and skills and then progresses to more occupation-specific courses. And this meets the new concentrator requirement. Okay, next slide, please. The Health Science Curriculum Framework has detailed course content outlines that will be posted on the NCHSE website in PDF and Word format so that the outlines can be manipulated for course design. The PDF of the framework will be attached with the posting of today's webinar. Because of the difficulty in viewing the entire document, this is a very small screenshot, but it shows a small sample from the first course of Foundations of Healthcare Professions. What I want you to note is the National Health Science Standards identified in red, as well as the course objectives and desired outcomes. And so all the course outlines will look like this. This screenshot shows a very generic course design example that outlines the CTE standard with a clear objective, evidence outcome, and then the standard alignment. And by providing the Health Science Curriculum Framework in Word, the teacher or administrator can actually cut and paste the standard, the objective, and the National Health Science Standard alignment for easier course design creation. So again, these 4 courses are samples, they're an example, but we know all health science programs are unique, and you might want to take these templates and massage them into something individual for your own program. So what does this all mean? How does this all come together? The biggest takeaway in 5 is overreaching things. Partnership is key, accountability matters, and data makes a difference. So let's start first with accountability. How does one determine if a CTE program is high quality? How do you account for that high quality? Well, role of assessments is huge in this piece. Assessment validates learning. Assessment gathers relevant information about student performance progress and informs classroom instruction. Assessment communicates to others the evidence about the learning process and provides accountability. And assessment, to be effective, should be useful, targeted, and sustainable. And we should also keep in mind that all valued assessments mirror a depth of knowledge that is appropriate for the level of learning, particularly when considering concurrent enrollments and post-secondary credit. So you want those assessments to be high rigor. This slide highlights the National Health Science End of Program Assessment that is aligned to all 11 National Health Science standards. What's difficult to see is it is supported by the Tri-Council of Nursing, and the Tri-Council of Nursing is actually made up of the American Association of Colleges of Nursing, the American Nurses Association, the American Organization of Nurse Educators, and the National League of Nurses. They don't endorse, but they do support. So this is a huge validation. The National Health Science End of Program Assessment is also endorsed by the Health Professions Network, HPN. Accountability and evaluation provide opportunities for data-driven decisions making regarding achievement gaps and performance outcomes. If you look at the report on the back of the certificate, it lists all 11 health science standards. It is this data from the assessment that speaks to business and industry and also informs the classroom. So the consortium also realized that the National Health Science End of Program Assessment was not an end-all, be-all assessment, that health science programs were unique and needed more assessment options. So we went to end of course assessments. And here's a list of the existing health science end of course assessments as of spring 2020. As you can see, they are more content specialty related. And this is where the National Health Science Curriculum Framework assessments will reside, with plans to pilot the assessments this coming fall 2020. In summary, gathering data from assessments is one of several important factors for yearly health science program review and evaluation. It's valuable data, and data drives decisions. And lastly, partnership is key. Boy, I can't say it enough. Perkins 5 clearly delineates its emphasis on workplace learning with significant stakeholder consultation. And this is where accountability and data play important roles. When asking teachers and administrators what is their biggest obstacles besides funding, they will frequently say, getting business and industry to the table, developing those partnerships, who approaches who, and how do we give a beneficial return on investment for all. It's probably the biggest bump in the road. One of the most critical pieces of any partnership is a strong advisory committee, and would be a great topic for a fall webinar. By presenting a strategic advisory committee agenda as part of your CTE program's invitation, you can cite good data-driven assets supported by high-quality indicators such as assessments, program completion rates, concurrent enrollment, etc. If you ask, and you ask well, they will come. And so this leads us to the conclusion of this part of the webinar on the new curriculum framework and assessments. And so I'll turn it over to Robbie to address the assessments for spring 2020 and 2020-21.
Awesome. Thank you, Cindy, so much. That was great. I've heard her presentation already a couple of times, and there was just something during that presentation that really stood out to me. I mean, there's a lot, so a lot of great information. Please go back once this is posted and take the opportunity to review. But one thing that really stood out that reflects a lot with what we're dealing with right now is how Cindy mentioned at the beginning with CTE and all of that, we always are facing these different challenges in CTE, both nationally at the state, district, and school level. And I think back to when I was teaching myself in a health science classroom, and I would collaborate with other teachers, both in my district and in the state. And I would identify with them, like I would teach a class, you know, starting with my standards going 1, 2, 3, 4, 5. And this other teacher, he would go 4, 5, 1, 2, 3, 6, 7. You know, so we would shift, we would change. There's different ways of doing things, and we understand that. And we're seeing that same thing right now with COVID-19 and the way that either government or school agencies, states, districts are handling, what is considered to be end of course assessments. What are we doing with those end of course assessments? How do we regulate proper proctoring techniques, both with all kinds of different organizations and groups, and how do we help these students get the most out of this particular school year? So I would love to talk just a little bit about where we're at with Precision Exams being the exam provider for the National Health Science Consortium. Like Cindy said, I will refer to as either the consortium or initiate at this point. NHSA, the National Health Science Assessment. Like I said, there's a lot changing. There's the cost of these exams are really at the lowest in the industry. And the only way that we as a consortium and through Precision Exams can maintain the price point for the value that we are trying to provide to your schools is to protect the integrity of the exams. And I completely understand, again, being a former health science teacher myself, I can't imagine or even comprehend what you all are going through at this time. And as we've met as a committee and as a group and with our CEO, we've determined that at this time we must adhere to these standards to protect the integrity of the exam. As soon as this ban on public gatherings is lifted, we want to be here to help support our teachers and students. If schools are not open until May or June, then we hope that there will be access to public buildings such as libraries or other public facilities where these exams could be delivered in a proctored environment where the proctor is physically present with the students. We want to be here for you, and we want to be here for you when you return to the classroom. We want you to be able to have a sustainable product that will allow us the ability to continue to offer our exams at the lowest price point possible in the industry, while our economy is continuing to struggle to equalize itself. That's the whole point and purpose of this. By releasing these exams, we released a lot of different issues and chances that I'm going to talk about here in just a little bit. But we really want to help maintain the future of these exams and also the momentum that we've built with industry and their recognition of them. The Precision Exams Help Center website, I have that listed both at the top there, and then also there's a QR code if you want to take a picture of that or scan that. This will give you access to our Help Center. This is where we have listed out some of the current outlines for the delivery and proper use of these exams at this time. I want to just talk a little bit about virtual testing and why we currently believe that this is not an option. So to do this example, I'm just going to escape out of this PowerPoint here, and let me actually stop sharing my screen. And even to make it even more fun, I'm going to turn on my camera, because who doesn't want to see my lovely makeshift office, home office here. But the point of this is I just want everybody to kind of take a minute to explain and understand what it is with virtual testing and what we're trying to avoid. What you cannot see or may not be aware of is down here, okay, there's my hand, down here is my keyboard. You don't know that I actually have my cell phone in my hand, and I'm actually able to text with one thumb. I'm actually pretty dedicated, pretty confident here, holding my phone up while also staring right into the camera. So you don't see that option that I have that opportunity to be using in a secondary device to look up answers. The other thing that you may not be aware of is I actually have behind this monitor that you're seeing right here, another additional monitor. That is, so I have a dual screen setup. You don't see the information that I may have open in an incognito window or on that screen. Now, this is the next part. I'm actually quite embarrassed to share this story. And as someone who works with exam validity and having the opportunity to have both my wife and children at home doing some homeschooling during this time, I actually went downstairs the other day to grab some lunch, and my son was sitting at a laptop computer similar to what I'm at now at the kitchen counter, with my wife standing in the background outside of the screen helping him with his Spanish homework. Google Translate was a great tool they discovered, and her being out of view, out of camera, was quite the easier way to help him complete that assignment. Now, I was very embarrassed and reprimanded them for that action, especially after what we're all trying to do here. But it really set home for me the idea of this is a difficult time for everybody. We understand that here at Precision Exams, but we also, again, want to be there for you all as teachers as we come back from this pandemic, as we return to the classroom, and as you have those opportunities to, again, provide these exams to your students in the coming years. We want to be that lowest price point leader for you here in the industry. And so that is, although it may not be the answer that a lot of you are hoping for or coming to this meeting to receive, unfortunately that is where we're currently at that point. Now, with that being said, let's not run away and hang up and be upset, because I do have a lot of other great information that I do want to share. As Cindy mentioned, and let me just make sure my screen is sharing. I believe it is, but let me just double check one thing here. Okay, there we go. Okay, so as Cindy had mentioned, Precision Exams, we currently have, or just recently partnered with, and will be working directly under the name UScience in the coming months, as we worked with them to align this awesome partnership. Precision Exams is not going away. Our certifications are not going away. Those are still going to be even more abundant with, like what Cindy mentioned, more and more opportunities coming out, both from the consortium and from what we are developing on our side. The addition of the UScience partnership is a great asset, a great tool. Let me just talk a little bit about that. And for those of you that have used UScience in the past, I hope you'll be able to chat in or explain, how it's been helpful in your own classroom. If you haven't, I am going to offer an absolutely free, no strings attached opportunity for everybody here at the end. And I'll pull up this website and that QR code towards the end of my presentation. But let's just talk just a second about what is UScience. So the combination, like I mentioned, of Precision Exams and UScience will allow you the opportunity to help your students, to align their talent, to increase their education opportunities, okay, being in the right place, getting them where they need to be, and introduce industry both into the classroom and into the future of your students. Through a series of brain games, we measure aptitudes, which help give us the best fit for those students. It gives them an affirmation of their natural talents. So also, we're going to be able to know how to better apply themselves into the economy more than ever before. So let's just look at one slide here I want to talk about. So interest-based surveys are great. In fact, we use interest-based surveys as part of the UScience journey. However, with interest-based surveys alone, they may steer students away from the economy, from that 80% of recommendations that are directed to social artistic careers. When you think of an interest-based survey that you've taken, you tend to, oh, these are the things I like. This is what I want to be. This is what I feel is, those social and artistic careers, the arts and entertainment. But what about the economic in-demand careers? What we keep hearing a lot in the news nowadays, those essential positions, those essential jobs. Aptitude aligned talent will help us get to those demand or those in-demand jobs. An analysis that was done with the top 50 most frequent careers made to public school students based on aptitudes and interests. We have the 4 key in-demand careers listed up here in technology, manufacturing, construction, and healthcare. Now, we look at that across all diverse ethnic groups. We see the interest levels are much lower in these top in-demand careers. Yet, when aptitude is measured and reported, we see a 2.1 times on average fit for the minority students to find those key industries. If we are always do what we've always done, then we're always going to get what we've always got. We need to break that mold. We need to help those students break out of, well, this is what's fit for you. This is the area that you are going to go down because this is what mom did, this is what grandparents did. No, we need to break that mold and identify and help these students realize that they have the aptitude to be in these careers in healthcare. Let me give you another example. This is probably one of my most favorite data points that we've been able to produce and identify here through these aptitudes. Aptitudes do not see race. They do not see gender. Okay, here in this diagram, I've circled healthcare. And we look at this, the dark blue versus the light blue, boys and girls. Okay, we have healthcare, patient care, and healthcare technical. So if we were just ask a group of students, boys and girls, we get a higher interest, as you all probably would agree, in the female population, in the healthcare patient care. I want to be a nurse. That's what I've always wanted to do. I love to help people. I took care of, my dolls when they were sick, or I did this, or whatever it may be. We want to help, these students who have this interest. And if you notice on this one, on the technical side, female population is not as high as maybe the male population in the healthcare technical side. But when we measure aptitude of these individuals, remember, aptitude does not see race, does not see gender. We see, yes, there's still an increase in the female population in patient healthcare, but it does actually decrease overall because some of those female or individuals, I'm not even going to say male or female, I've had students who come to my classroom and say, man, I want to be a nurse, I want to be a doctor, I want to be a dentist. And then, well, I don't like blood or bones, or, oh, I don't like to see somebody lose a tooth or pull one out. I'm a technical person, I still want to be in healthcare. So that is where we see a great spike here in the female population with technical healthcare. Maybe they don't like the blood and those types of things, but this is what's going to help drive these students. I was amazed when I took my first aptitude test with U-Science on what I was able to discover both about myself and what careers interested me. My background initially was in sports medicine, and it's still a career choice that I love quite dearly, and that actually was one of my top fits when it came to my aptitudes, just because I like that hands-on, being involved role and piece. And that's the cool thing about these aptitude tests and using these brain games, is because they're going to have different types of activities that will help to measure and get a better understanding and ideas of where those students align. We have career fits and how that student aligns to what are the different aptitudes or roles that are needed within those particular jobs. With you, science is all about discovering the science of you. Okay, cutting through gender, social, basis. Our students are able to see those visions of those opportunities that they have ahead of them. It helps to align talent with curriculum pathways that best fit. Highlight the student's talent and get that out through community engagement. Okay, now here's the best part. Okay, here's what I really wanted to focus on and get to for today. HSE members, and I'm even gonna open it up for today and this group. If you are part of this webinar, if you're watching this as a recording, or if you're live with us today, please take advantage of this opportunity. You can scan the QR code there or visit that website, get you to the same place. This gives you a form to fill out to reach one of our regional directors. Basically, they're the individuals who are over your particular state or area where you're located. This is a free resource for you, your students, to be able to come in, get an idea of what they are at with their aptitudes. What are the career options best fit for them? Other things that our regional directors will show and share with you is how not only do we get the interest in the aptitude assessments, but we also have, and you can't really see it on this screen, but it's up here in this right corner, an alignment to the different careers and best fits and how those different career opportunities align. Also what colleges and are in your area that may be offering these types of programs. So a lot of great information that we are moving towards in the very, very near future. So I encourage each and every one of you to take an opportunity to at least reach out and try this for yourself. If not, use this free opportunity to expand out to your students. Give them the chance over these next week, days, whatever it may be, that you're looking for some additional assignments or some additional activities for them to be doing at home. Give them this opportunity to align with their aptitudes and their career interests and so on. So with that being said, I'm going to hope that Cindy joins us back with on the microphone here. And we do have the ability to entertain a few questions. Phyllis has been entering and responding to some of those there in the chat. I haven't been able to keep my eye on that chat completely, but is there anything, Phyllis or Cindy?
Robbie. Yeah. Let me just say a couple of things. The way it's thundering at my house, so y'all may hear that. It's raining and thundering. Sorry about that. I can't control that part, but Nancy did want me to share with y'all that this webinar, as well as all of our others, will be, and some people ask about this, will be posted on our website. So that's www.healthscienceconsortium.org/webinars. And then also she wanted me to tell you, if you wanted to earn a certificate, it's not a CEU credit, but it is a certificate verifying, that you participated today. You can email her, and I can put this in the chat box as well. You can email her at nancy@healthscienceconsortium.org and just let her know that you're interested in getting a certificate. We want to be sure you knew, like I said, that all of our webinars are posted. There's lots of resources there on our website. And I think, Robbie, that I need to unmute Cindy, and she should be able to get in on some of these other questions. So give me just a second. Let me see if I can get her unmuted.
I'm unmuted.
Okay, Cindy, are you there?
I am. Can you hear me?
Yes.
Great. Okay. Do we have any questions? I'll lead it back to you, Phyllis.
Okay. Somebody says, I have students who are currently participating in paid public health internships. Should I assume this addresses the area of work-based learning as described here? I help to develop an internship with public health department for the city. These duties are not clinically based, but focus on health education and outreach.
Okay, I heard part of this, and the other part was very choppy. So what I heard was that they have a student that is involved in an actual internship, apprenticeship situation, and could this be considered work-based learning? And from the sounds of it, to me, it would definitely constitute work-based learning, but the rest I could not understand. It was too garbled.
Okay, I'm sorry. It's bad weather here. She said that these duties are not clinically based, but focus on health education and outreach. So maybe that we have to get back with her on some information on this particular question.
Yes, I would think so. More specifics.
Yep. We just want y'all to know that we're going to try to answer all the questions, but we do get a copy of this chat box. So if we missed a question, we'll be able to get back in touch with you and let you know that answer that you're asking about. So if we don't have Nancy on here with us, so if there's something that you ask that maybe she would be more able to answer for you, or if we miss it, we'll get back with you on those. So I also said, actually, Katrina is on with us, who works with our Educator Association. She said the data from this assessment is how we change our lesson for next year. We usually stick it, so we change how we introduce it and include it in the one course.
Oh, okay. Again, I think I heard Katrina using data from assessments to inform the classroom. I'm so sorry, but I couldn't understand the rest of the statement.
Yeah, I believe it might be best, like Phyllis had mentioned, and I'm hoping you can hear me, but I think it might be best, as Phyllis mentioned, that we can address a few of these questions after the fact. We'll either contact you via a personal email or put some of the responses in with the webinar. In fact, we could record some of those, or again, give you a written statement on that. But I do apologize. Yeah, some of those are not.
Robbie, what I've done is I've clicked, Phyllis and Robbie, I've clicked on the actual chats. So I see Katrina's statement that how they inform the classroom from the assessment. And so she actually says that they usually score low in the systems standard. And so they changed how they introduced it and then include it in more than one course. And that brings the grade up. So I'm going to take over this list. Phyllis, can everybody hear me? And I'll address some of these questions that I'm reading.
Yep, sounds great, Cindy.
Okay. The next question from Jennifer Bruner says, how do you ask and ask well for that partnership with industry? And again, I was speaking to the advisory committee and developing those partnerships. I can't say enough. We'd have to go into detail for advisory committees, but when you do your invite, you have to attract that business and industry for something that they want, and that's a very high quality candidate for employment. And so within your ask, in your invitation, you're going to actually woo that person with how qualified a program you run. And you'll see that reflected in your agenda on the items that you're addressing in that meeting. And so when they look at that agenda that accompanies that ask, that invitational ask, they see that it's well worth their time because you're going to go over very strategic and focused agenda on addressing, producing a very high quality candidate that they want to employ. So that's keeping it real simple and basic, but again, it would be a very good webinar for the fall. All right, and there's another, obviously business and industry, there's another question, but this one is original criteria for placement was based on students who were 18 and were seniors. This is from Eastside Memorial School. I have students who are 16 and testing for medical assistant and certified nurse aid exams. Can we get industry to adopt standards on 21st century base, not 20th century standards? This is a real conundrum where there is state laws and there's other pieces that prevent employers from employing anyone under 18. There's a lot of liability, etc. And so that when I talked about assessments and credentials being sustainable, that's what that's addressing. When you have a 16-year-old who is very qualified but unemployable, and in 2 years, do they still have those skills that they earned that credential with? So I don't have an easy answer for this one. Another question is, can we share this information, webinars with other teachers? Absolutely.
Yes, please do.
That was from Lori Mackey.
And the screen that I have up, you know, like I mentioned, we would encourage, this is with U Science piece, a free resource for anyone who's, you know, in attendance today, or if you want to share that with other teachers in your districts and schools, we'd be happy to extend that as well.
Okay, good. That's an important point.
Mm-hmm.
The option to offer students precision exams due to closures for this year, I think that we'll have to deal with, particularly by email. That's a very extensive problem solving. Some schools go back, some might, but you want to
exactly.
address that,
And we're just, like I mentioned before, we're trying to look at that on a case-by-case basis. We're hoping, you know, soon enough there will be opportunities for testing to be open, but until then, that's where we're trying to identify other opportunities with the U Science option. And I know the certification has come up with a couple different emails that you know I've received personally and I've addressed. And again, I can't stress enough the hope and opportunity we have for the future, both the consortium and these certifications, by maintaining that industry low price to you all in the future. As soon as there is an opportunity for you to be with a student physically to provide that on-site proctoring, we'd be happy to open those up.
Okay, and that's one of the questions. And again, case-by-case basis, just like Robbie said. Another question I see from Marjorie, is there any plan to extend this to the junior high level, especially in the light of the fact that CTE has gone there, and encouraging kids to consider health science as a career opportunity? Yeah, you know, and I would like either Phyllis or Robbie to also jump in with this question. It's definitely reaching down in the junior high level, though on a very general basis, in my opinion, as far as exploratory and keeping it very foundational.
Mhm. And with the addition of these additional courses and new framework that Cindy introduced, yeah, there will be more opportunity that way. Our current exams, we try to keep them at about that 7th grade reading level, open to most 9th to 12th grade. But yeah, there are some middle schools that do include or start to incorporate these exams into their curriculum. So yeah, that's definitely a case-by-case scenario that we can work with. And if you want to let us know your particular state or location, we can get you with a regional director who can help discuss that even further.
Okay, and now I see a question from Eastside Memorial School. Will there be any opportunities for medical interpreters at any time? Most of my students are bilingual, and it would appear they would approach this pathway. Does NCHSE offer exams for medical interpreters? To my knowledge, no. And Robbie and Phyllis, you might want to interject with that. But in Colorado, interpretation and also sign language was not assigned to health science. It was put in the education career cluster, and not sure why, but it's amazing how medical interpreters and sign language, etc., where it's placed in career clusters. So Phyllis or Robbie, do you have anything you want to add?
Yeah, I agree. We get all kinds of inquiries about different exams and different opportunities in the future, you know, that we hope to create. I don't know that that's one that's on our list right now, but I'll definitely bring that up to our exam development team. It's so interesting how some areas need those in certain parts of the states and country, and others it's not as popular. But I will add that to our list and see where we get on that. I don't know of any others aside that offer that, but we can definitely look into that. We might have some of our other partners who do offer similar type exams or have connections that way. So yeah, let's leave that one to be added to the list to provide additional information as we reach out to our other partnerships.
Okay, are there any other questions? I'm quickly scrolling through. Oh, we have a new message. Let me look. Okay.
Looks great. Well, again, I'm going to leave this slide up. We'll post that. I just want to thank everybody who was able to join us today, whether you're live with us or whether you're watching this recording. We wish you all the best, at least, you know, from Precision Exams and U-Science. We are very much being mindful of you and what you are going through in this difficult time. We hope to, again, to continue to be able to provide you the absolute best coming into the future and what may be of our economy. So we hope to continue this partnership long into many years to come. So, Cindy?
Okay, and thank you, everybody. I want you to take care and be safe. We will all get through this, so thank you so much.